Hello. I'm Dr. Aamir. Welcome to today's health session. Today we will discuss a condition known as hernia. Dr. Aamir, what is hernia? A hernia is a medical condition where an organ or tissue pushes through a weakened area or opening in the surrounding muscle or connective tissue. This can lead to a noticeable bulge, often causing discomfort or pain. Hernias commonly occur in the abdomen or groin and may require surgical repair. Dr. Aamir, how does hernia happen? Hernias occur when there is a weakness or opening in the muscle or connective tissue that normally holds an organ in place. This weakness can be present from birth or develop over time due to factors such as aging, excessive strain, heavy lifting, chronic coughing, obesity, or previous surgical incisions. When pressure builds up inside the body, the organ or tissue can protrude through the weakened area, causing a hernia. Dr. Aamir, what are the main causes of hernia? The main causes of hernias include weakness in the muscle or tissue. Hernias often result from a congenital or acquired weakness in the abdominal wall or other areas where muscles and tissues are supposed to provide support. Aging. As people age, their muscles and tissues can naturally weaken, making them more susceptible to hernias. Heavy lifting. Frequent heavy lifting, especially when done incorrectly, can strain the muscles and lead to hernias. Chronic coughing or sneezing. Conditions like chronic obstructive pulmonary disease that cause persistent coughing or sneezing can increase abdominal pressure and contribute to hernia development. Obesity. Excess weight places additional strain on the abdominal muscles, potentially leading to hernias. Pregnancy. The increased abdominal pressure during pregnancy, combined with hormonal changes, can contribute to hernias in some cases. Straining during bowel movements or urination. Conditions that cause chronic constipation, difficulty urinating, or prolonged straining can increase the risk of hernias. Previous surgeries. Surgical incisions weaken the surrounding tissue, increasing the chance of hernias at those sites. Genetics. Some individuals may be genetically predisposed to having weaker connective tissues, making them more susceptible to hernias. Trauma. Direct injury to the abdominal area can weaken the muscles and contribute to hernia formation. It's important to note that while these factors can increase the risk of hernias, not everyone with these risk factors will develop a hernia. Maintaining a healthy lifestyle, avoiding excessive strain, and practicing proper lifting techniques can help reduce the likelihood of hernia development. Dr. Aamir, how is hernia diagnosed? Hernias are typically diagnosed through physical examination, where a doctor identifies bulges or areas of weakness. Imaging tests such as ultrasound, CT scans, or MRI may be used to confirm the diagnosis, assess the size and location of the hernia, and determine the best treatment approach. Dr. Aamir, what are the signs and symptoms of hernia? Common hernia symptoms include a visible bulge or lump, often felt during activities like coughing or lifting. Discomfort, pain, or aching at the site, particularly when straining, are also common. In severe cases, nausea, vomiting, and difficulty pushing the hernia back in might occur, requiring immediate medical attention. Dr. Aamir, who is more vulnerable to hernia? Individuals prone to hernias include those with weakened abdominal muscles due to age, genetics, or surgeries. Heavy lifters, chronic coughers, obese individuals, and pregnant women are at higher risk. Men are more vulnerable to inguinal hernias, while women can develop hernias in the groin and abdomen due to pregnancy and childbirth. Dr. Aamir, what are the types of hernia? Common types of hernias include inguinal, groin, femoral, upper thigh, umbilical, belly button, incisional, resulting from prior surgery, and hiatal, upper stomach. Additionally, there are obturator, epigastric, and spigelian hernias. Each type involves different areas and causes, requiring specific treatments based on severity and location. Dr. Aamir, which is the most common hernia? The most common type of hernia is the inguinal hernia, which occurs in the groin area. It is more common in men than women and can develop due to a weakness in the abdominal wall. Inguinal hernias can be direct, through a weak spot, or indirect, through the inguinal canal, and often require surgical repair. Dr. Aamir, what happens to inguinal hernia? In an inguinal hernia, a portion of the intestine or abdominal tissue pushes through a weak spot in the abdominal wall near the inguinal canal in the groin. This results in a visible or palpable bulge that can cause discomfort, pain, and other symptoms. Surgical repair is often necessary to correct the hernia. Dr. Aamir, what is the first aid for inguinal hernia? If an inguinal hernia becomes incarcerated, unable to be pushed back in, or strangulated, blood supply is compromised, seek immediate medical attention. While waiting for help, avoid pushing on the hernia, keep the area relaxed, and lie down with hips elevated. Don't attempt to manually push the hernia back in without medical guidance. Dr. Aamir, what is the treatment of inguinal hernia? The treatment of an inguinal hernia typically involves surgical repair. There are two main approaches. Open surgery. A small incision is made near the hernia site, and the protruding tissue is pushed back into place. The weakened area is reinforced with sutures or mesh. Laparoscopic surgery. Several small incisions are made, and a tiny camera and surgical instruments are used to repair the hernia with the aid of a video monitor. The choice of surgery depends on factors such as the patient's health, the size and type of hernia, and the surgeon's expertise. In some cases, especially when the hernia is small and not causing symptoms, watchful waiting might be an option. Always consult a healthcare professional for personalized advice. Dr. Aamir, how much time does it take to start normal life after inguinal surgery? Recovery time after inguinal hernia surgery varies. Many people can resume light activities within a few days to a week. However, full recovery may take several weeks, during which heavy lifting and strenuous activities should be avoided. Consult your surgeon for personalized guidance on returning to normal activities. Dr. Aamir, what is the precautions of hernia? Lift properly. Use your legs, not your back, when lifting heavy objects. Maintain healthy weight. Obesity can strain abdominal muscles. Treat cough. Manage chronic cough to avoid pressure on the abdomen. Avoid straining during bowel movements, urination, or lifting. Stay active. Regular exercise can strengthen muscles. Manage chronic conditions. Address constipation, COPD, and other conditions contributing to hernia risk. Thank you, Dr. Aamir. It was sound knowledge shared with everyone. It is requested to kindly subscribe to the channel and share with your loved one and community for health awareness.